Organization for Women in Science for the Developing World. I'm delighted to be able to tell you actually that we just heard this morning that we've just been shortlisted for a Nature Prize for innovation and outreach, and they've just put that announcement up on their website. So we're really delighted, and we're having another press conference at 4 o'clock to talk about that. Basically, we are based here in Trieste, along on the ICT campus, and we've been working to support women scientists from the developing world for 30 years now. And we work in the developing world, and specifically we have 66 countries which are least developed countries or scientifically lagging countries that can be the recipients of funding for different programs that we have. We have over 5,000 members who are all women with at least a postgraduate degree in science or social science who live and work in the developing world. When there are more than 20 members, they can establish what's called a national chapter. And we have over 36 national chapters right now and more pending. And these chapters are opportunities for women in the country to get together, women scientists, and they identify by meeting for the first time often what their challenges are, specific challenges in these different countries. And then they start to work on different solutions, which could be sometimes workshops, sometimes they're outreach activities, sometimes it's assisting each other to write grant applications and things like that. So what that gives OWSD is incredible feedback about what the challenges are for women in all these different countries around the world and how we can adapt our programs to make sure they really are responding to the needs that they are identifying. Our most important, our oldest program that's over 25 years old is a PhD fellowship scheme. And this is funded entirely by SIDA, which is the Swedish International Development Cooperation Agency, who had the long-term vision all those years ago to understand that by investing in PhD degrees in science, women in science, women would then have the opportunity to encourage other women to become scientists in a kind of snowball effect. We have nearly 300 graduates from that program, and these are all women coming from really the poorest countries in the world. So it's quite an achievement. And they select where they want to go and study, and many of them, and they can only go to developing countries, but that might include Malaysia, China, India, Brazil, South Africa. So it's a south-to-south program. A very important program that we introduced us 2 years ago, again in response to needs identified by our members and our fellows, is an early career program, early career fellowship. And the idea about this fellowship is still the same identified countries that are eligible to apply for funding. It's a big grant, it's $50,000 over 2 years. It's awarded by the Canadian International Development Research Centre. And this fellowship enables women who have returned back to their home countries to set up centres of excellence. So when women return from, by definition, they have to go abroad to get their PhDs, and they return home and they find that they're still in the same situation logistically that they were in before they left. The labs are very poor, they don't have good contacts, they don't have access to all of the resources that they had when they were abroad. And this grant allows them to be very flexible and select exactly what they need in order to continue their research at international level. That might be inviting scientists to come and give lecture series. It might be setting up laboratories, getting equipment. Sometimes it's even getting some childcare support, because the early career period very often coincides for women with the period when they're also trying to set up families. And so that's quite a challenge. The third program, and this is the program that we're here today with Uduak Okomo, who was a recipient of this award in 2019, is a special prize for 5 outstanding women, again from the same identified 66 countries, who have shown that they're doing excellent research despite all the challenges that they face. And the reasoning behind this award is that giving scientists such as Uduak, and this is another example, another opportunity for Uduak, giving her visibility in an international context will enable her to continue developing her networks. It also means that she serves as an incredible role model for other women in her country and for other women who may be thinking that this is too much, there's no way that they could manage to do such a thing. And just having contact with somebody else like them who has managed against all the odds is incredibly important in terms of trying to build up women in science in the developing world. So that's the background to OWSD, and please do ask any more questions afterwards if I've missed anything out or you want to know anything extra. We do have Domiziana in the room, who is from the Elsevier Foundation, who have been funding this award for the last 13 years. I think we've been since, well, 2010 was the first edition, and then we refined the editions from 2013 onwards. So we're delighted that Domiziana could be here in the room with us today. And again, any more questions about the award, please do ask either of us. And also we've got Erin Johnson in the room here, who is our communications person and does all of our website and social media. So Uduak, are you still there after that long introduction?
Yes, I am. I am.
Hi. So just say a little bit about you, Uduak, before we start. Is that okay?
Yes, that's fine.
So I met Uduak in 2019 in Washington, D.C., because she was the recipient of the 2019 OWSD Elsevier Foundation Award. And part of that award, the prize itself is quite modest, it's $5,000, but the additional aspect of the award is to go to the AAAS meeting in whichever city it's been held in that year. And there's an opportunity then to present your research in front of hundreds of people and to make lots of contacts and connections within your discipline. We also visited the embassy in Washington, D.C., Uduak, didn't we, together? Actually, the Nigerian embassy.
Yes, we did. Yes, we did.
Originally from Nigeria. So I don't know, would you like to say something just about the experience of the award, Uduak, just briefly?
Yeah, so thank you, Tanya, for inviting me to speak during this press tour. And yes, the award was really an amazing period in my life. I'm still trying to get over it. And even though it was just last year, it was more or less a really surreal experience. And being invited to Washington and being able to present my work before so many people, and all the visits we made to the Academy of Sciences and the other places we visited, it was really, really a life-changing experience. And I also got to meet some other interesting and wonderful female scientists from other parts of the world. But you know, what the award has done for me since then is really, to me, mind-blowing, because it's given me visibility, and I've made so many contacts and collaborations, expanded my career network through the award. And like you said, it's all about being visible there for other people to see that, you know, work is possible from developing countries, that female scientists just have in these countries have what it takes, you know, to do excellent work. But sometimes we might not get the opportunity to be out there on the stage and let people know what we're doing. And I've been able to mentor so many female scientists, not just in the Gambia where I work, in the Nigeria where I'm from, but even just across the world. People contact me. I meet people at conferences and they chat with me and want to find out, you know, how I've done what I've done and what opportunities there are for them. Sometimes just to encourage them on a personal level that irrespective of, you know, the challenges they face, it's possible to have a fulfilling career in science.
Thank you, Uduak. And just looking at your biography, which I've been aware of for some time now. I know that you did your undergraduate in Nigeria in medicine, and then you did some more work in pediatrics and epidemiology. I think already in the Gambia. Is that right? After doing your degree.
Yes, after doing my first degree in medicine in Nigeria, and then I specialized in pediatrics. And so I then moved to Gambia to work at the Medical Research Council unit. It has a very long name now. We became part of the London School. So it's now MRC Unit The Gambia at London School of Hygiene and Tropical Medicine. And so I joined the MRC in 2004 as a medical officer, but I really had a passion for research, and I went on to do a master's in epidemiology and also a PhD in epidemiology.
And that was in the
with the London I did them with the London School of Hygiene and Tropical Medicine.
Yeah.
So
I imagine at that point when you were in London, there could have been the possibility that you would stay in London. I imagine you were quite an outstanding researcher, and there would have been opportunities offered to you to stay on or to perhaps stay in Europe. Was that the case? And I just wonder if you could speak to us a little bit about your choice to go back to the Gambia. Was it a difficult decision, and why did you make that choice?
No, so it wasn't a difficult decision, and then I didn't move to the London full time. So because of the relationship, the long-standing relationship between the MRC unit and the London School, and the fact that my PhD work was going to be based in the Gambia. So I was primarily based in the Gambia, but I had to go to London School at least, 2 or 3 times every year. So either attend some coursework, meet with my supervisor, and all of that. Yes, there were opportunities for me, and there still are opportunities for me possibly to work in the London or anywhere. But for now, I always wanted to remain in Africa. And so I think I made that decision even before I did a PhD and a master's, because what was common then was after your first degree, you'd go abroad either to the US or UK and specialize and just make a career in medicine there. But I chose to remain in Africa because I feel that Africans have what it takes to solve the myriad problems that we have. And if everybody is leaving, then, it won't be good for the continent. And so my heart, has always been here. And yes, so that's why my career has been here for now.
And I remember when we went to the Nigerian embassy together, I remember that they were a little bit dismayed that you were no longer in Nigeria and that you were in the Gambia. And, it was a kind of betrayal. Is there anything that you about that?
Yeah, so I think a lot of Nigerians feel passionately because about Nigerians, working, in the diaspora, and it's understandably so because Nigeria being, a very prominent African country in terms of its economy, in terms of its population, and also because it does have a lot of poor health indices, and there is a shortage of health workers in many areas. We would feel that it would be great if everybody could stay, but it's not just that easy, and it's a bit of a political issue. And I mean, you were aware that day, I mean, with the ambassador, I was going back and forth and we're arguing about it. And yes, but I think what's most important is that, health and diseases don't respect borders. And I'm not lost to Nigeria, and I'm not, I think I still have a heart for Africa. Gambia is in West Africa, and as long as I'm on the continent, and even if I were outside, but more so because I'm here, I can still improve the health of people across the region, wherever I am.
Fantastic. Thank you. Uduak, it would be great if you would like to tell us a bit more about your research in detail.
Yes, so my research is primarily looking at maternal and newborn health, and I've really been passionate about that over the last 5 to 10 5 to 6 years actually. When I started off as a pediatric trainee, I really did like neonatology. It was my first posting. But moving into research, I delved more into child health as a whole, and looking mostly at older children and infectious diseases. But a stint at the National Hospital here in Gambia and working in the newborn unit and seeing the high um, case fatalities among babies that were admitted to the neonatal unit, I started asking myself questions and said it wasn't just enough to record these deaths, but we needed to find out why these babies were dying and what we could do to stop them. And so that really was the journey for my PhD in neonatal infections and the work I've done since then, looking at infections in newborns, looking at transmission dynamics in the hospital, the community, looking at antimicrobial resistance and other indices and things that are related to newborn health, but also maternal health, because the health of the mother and the newborn are inextricably linked. So that's really what I've been doing.
Would you like to share your slides with us, Uduak?
Yes. So can you see my slides?
Not yet. Yes. Yeah.
Okay. Yes. So I'm not presenting my work today, but when Erin spoke to me about the press tour, we felt that maybe we could talk about something that's a bit more topical and which the rest of the world might not have insight into what's happening in developing countries. And that has to do with the COVID-19 pandemic and how it's affecting maternal and newborn health in developing countries. So that's not to say that COVID-19 is not affecting the health of everybody. It is. And but given that this is my area of specialty, I'll be focusing on maternal and newborn health. And I think there's a problem. My slides are not moving.
She's not disabled from.
Maybe stop sharing.
Okay. I should stop sharing the screen?
And go to the next one and then share again.
Okay. Seems there's a glitch.
You don't have to do this every time.
No, it's frozen. Okay. Is that better?
Not yet.
Okay. Well, I've changed to the next slide. Do I need to share my screen again?
Yes.
Yeah. Okay. Is that better?
Yeah. It's good. Great. Thank you.
Yeah. So each year, over 5.4 million women and newborns or die globally. And most of these deaths occur in developing countries. And in the red boxes, you can see that they actually occur in two regions of the world, Sub-Saharan Africa and South Asia. And the statistics are pretty grim. So there are about 2.6 million stillbirths, 2.5 million babies who die in the first 28 days of life, which is the newborn period. Another 15 million babies at preterm, and just under 300,000 women die during pregnancy and childbirth. So these are quite staggering numbers. But there seems to be an issue with okay, sorry. Fine. So most of these deaths are preventable. And so that is really good news. And the World Health Organization, UNICEF, and a lot of other agencies do have a number of strategies in place to ensure that women, children, newborns, adolescents, they survive, they thrive, and they're able to transform their lives and become and lead very meaningful lives. And for newborns, we also have action plans, and you have the Every Newborn Action Plan, which I've shown a snapshot there. So what services are available for mothers and newborns? So we do have antenatal care, where women who are pregnant go to the hospital to have their health checked, ensure that the baby is growing well and they are also doing well in their health. And it's recommended now that women have at least 8 contacts with the health provider during the period of pregnancy. The women also need access to good childbirth care while they're in labor, and of course postnatal care to check that the woman does remain fine after having the baby, and the baby's fine. And for babies who may be sick or small preterm, they would be able to receive adequate care in a health facility. But there are also lots of other related services, such as early child vaccinations, and of course family planning, which is important to ensure that women and babies are healthy and every pregnancy is wanted. So what has the COVID-19 done to this? So apart from the direct effects on healthcare services and causing death and morbidity. So in this picture, you can see there's a woman who is infected with COVID-19 and she's nursing her preterm baby in kangaroo mother care. These are the direct effects. So people are sick with COVID-19 and they eventually die, or they might recover. But COVID-19 also has a lot of indirect effects, which are brought about by the national and subnational responses to the pandemic. So during the pandemic, we've seen that many countries have gone into lockdown, either nationally or regionally, to restrict movement and also to see if this can lead to a restriction or a fall in the number of cases. But these themselves have an indirect effect on healthcare services. And this would lead to affect the availability of healthcare workers, also the demand for services, access to health services, and the availability of supplies and equipment. And studies have shown that because of these restrictions, fewer women are able to go to the healthcare facilities, fewer women are able to deliver in health facilities, and fewer women are attended to by a skilled birth worker. So this might be a nurse or a doctor when they're pregnant, or a midwife. And also there's, for countries that are heavily dependent on importation, or even just movement of goods from one part of the country might be affected due to restrictions in movement. And so there's lack of essential supplies and equipment. And also the access to health services might be impeded for people that have to take public transport to healthcare facilities. Then of course, during restrictions brought about by the lockdown, they're not going to be able to get to the health facility in time, or even get transport at all to go. So all of these themselves indirectly affect maternal and newborn health. And studies, a particular study that was recently published in the Lancet Global Health, showed that in Nepal, which is another developing country, that there was increased incidence of women experiencing a stillbirth or a neonatal death as a result of restrictions brought about by the lockdown. And also there were fewer women who were able to go to a health facility to deliver, and most of these women were either delivering at home in conditions that might have been suboptimal. And so essentially it's important that that we protect care for women and babies, and governments need to make this a national priority, and to ensure that women and babies survive and lead healthy and happy lives.
Thank you. That was so clear and so relevant. Thank you. That was wonderful. And maybe ask anybody if they have a question. Yes, please. Would you like to come here maybe and speak? That would be great.
Can I take there? Or,
yeah.
Okay. Thank you. I have a question. Here in Italy, we had an increase of medicalization of childbirth during the lockdown for the emergency. In spite of recommendations from WHO about not separating mother from child, did you have any similar situation in Gambia?
So please, could you take that again when you talked about medicalization and separation, so I can understand your question clearly?
Ah, yes, sorry. In Italy, we had an increase of medicalization of childbirth because of the emergency and during the lockdown. In spite of recommendations from World Health Organization about not separating mother from child to avoid contagion. Did you have any increase in medicalization also in Gambia?
So in Gambia, we don't have, Gambia is a small country, so we didn't get to talk about that, and just a population of about 2 million. And the pandemic was rather slow in getting here. And currently, we have just about 2,000 cases, which is quite a lot for a small country, but that's just happened in the last few weeks. And we have not had similar experiences as other countries. I don't know if I answered your question.
I think the question was about so in Italy we had the situation where we had to separate COVID cases from other medical cases, right?
Medicalization in all childbirths, also with non-positive mothers.
Right. Yeah. So as a consequence, I mean, so usually there wouldn't have been this medicalization at childbirth, but so when you say medicalization, would you like to
I think that's what I need to understand.
Yeah. More labor inductions and separation of the mother from the partner during the labor, and the separation of the mother from the newborn early after the birth.
Yeah. Yeah, because there was such a fear of contagion. So if you would go into the hospital for some other disease, or if you would go in for childbirth, there was the terrible fear that you would catch COVID. So they were separating everybody out, and that meant that even partners of, you know, mothers would not be able to be there at the birth, and then the child was separated very early on from the mother.
Okay, so I think first of all that the birthing situation is completely different. So here in Gambia, you wouldn't have a woman wouldn't have her partner in the delivery area, the delivery suite, either in the theater or in the labor ward. So it's not the custom and the practice here. So you know, that wouldn't have been affected. And then also, due to the way the structures of the facilities are, mothers would be separated from their babies if the baby required resuscitation and needed to be admitted. And so sick babies are not admitted together with the mother. They're admitted in a completely different wing of the hospital. So this is irrespective of the COVID-19 pandemic. And then also, as I said, we're just beginning to see our own wave and a number of cases. And so in terms of the breakdown by age and whether the number of women in pregnancy who are supposedly infected, at this point, I don't have that information, but there's an ongoing study that's trying to look at that.
Actually, Uduak, I was thinking that goes back to the research that you were doing, at least when I was talking to you in Washington, you know, that you had identified that one of the main causes of infant mortality in the Gambia was actually infections in the hospital, infections picked up in the hospital. So maybe there is anyway a kind of heightened sensibility to the possibility of infection, which is what we are now experiencing because of COVID. But maybe in the Gambia, that's a kind of typical situation.
Well, yes. So infections acquired in the hospital are a major contribution to newborn deaths in the Gambia. But you know, also because we've had a lot of time to prepare. There was the recent Ebola epidemic in a number of countries in West Africa, even though Gambia wasn't affected, but they did put a lot of things in place. And during this COVID-19 pandemic, we've been able to fall back on some of those things. And so there is a lot of attention paid to infection control and making sure that healthcare workers are as properly protected as possible, so as to minimize the risk of they themselves being a source of transmission of infection. Though a lot of healthcare workers in Gambia have been infected, but currently we don't have the high numbers of symptomatic cases that the rest of the world is seeing. So most of the people here are asymptomatic, and so we just self-isolate and then come back to work. Yeah.
And have you had issues with PPE equipment there, like and masks being available and ventilators and those, like a lack of resources?
So I don't directly. So currently, I'm not clinically active. So I'm not going to the hospitals that much. But I think the issues with PPE are a global thing, because as long as a country is not manufacturing them and has to import, then of course there are going to be delays in supply. And so we have had a few issues, but we are working hard, and I think there've been some very nice magnanimous donations from other countries which has eventually arrived. And so PPE is not as much as a problem as it could be in other places. And we're trying to see how we can make sure that we order supplies and they arrive as soon as possible and manage what we have. Then again, it's a small country.
Thank you. I have a question as well about because we're here at ESOF, which is this, as you know, this European Open Science Forum.
Yeah.
And I'm just wondering what you think about how scientists from the Gambia, from the developing world in general, can collaborate, interact more with European scientists. If you've had any experience of this, and how you think what the benefits are also maybe for European scientists to interact with developing world scientists. We had a session on Sunday evening at the Cafe San Marco where we wanted to invite students from Trieste to meet some of our fellows, and we had an online interview with one of our early career fellows, and we were trying to see if there was possibility of just starting a relationship. We might just be mentoring, but also just to see if they had similar challenges, if they could identify why it might be important to share research between these very different continents and experiences.
So I think it's important for there to be collaborations in every level. So whether it's North-South collaborations or South-South collaborations. And first of all, it enriches everybody's knowledge, and you really get to know more about another area. And especially so for developing countries. And so there's this movement to decolonize global health, and it's important to listen to the people who are on ground, who work there, and who that is their life experience working in very resource limited settings, and to find out what their challenges are. And their challenges are generally more or less of resources and not necessarily intellect. So with such collaborations are enriching for both groups of people. So people from the north, the global north, the scientific north, get to see how people still are able to do exceptional work despite their limited resources. And then people in the global south get to see that it's possible to go beyond what you're doing now if you have the right exposure, if you have the right equipment, and if you have a mentor and someone who's willing to help you, learn the ropes and acquire more knowledge and skills. I think it's enriching for everybody, and it would be a good way to to proceed, how that would, you know, be made possible. At this point, it's difficult to say because the world has changed. So before it used to be, okay, there'll be exchange programs. People will apply for a visa, probably go and look for funding and spend a few weeks to months, maybe a year or so in another place and acquire skills. So it's an exchange program, you know, and they go back and they're hopefully able to take the experience and improve their work and their research. But now that a lot of things are happening virtually, it's still possible because at least the virtual meetings remove the need for visas and travel costs, but it also puts a strain on some hands-on experience that you can't acquire virtually. And so moving forward from after this pandemic, I think a lot of things would change, but you know, it's really difficult to see that at this point.
Thank you. That was very clear, wonderful information. Thank you. Does anybody else have any questions for Uduak?
Hey, Uduak, I just had a quick question because I was reading an account of an OBGYN in Nepal, and she was mentioning that they had started preparing a lot of virtual materials for their patients who couldn't come to the hospital, to the clinic. Like they made some videos advising them what to do, what not to do. And I'm just wondering if you've seen anything similar in the Gambia, like people using virtual solutions to this.
Oh, okay. So we have had a lot of videos mostly geared towards or focusing rather on prevention and keeping safe during the COVID-19 pandemic. And as regards other aspects of healthcare, maternal and newborn health, I haven't seen any. But as I said, this is for many countries, this pandemic is an eye-opener to change the way we do things. And so in the past, we've relied a lot on women coming to the clinic and receiving that information face to face in their, let's say, the antenatal clinic. And so we've not really tapped into the use of information, digital information and e-health. And I think this pandemic has shown us that it's important. You can reach more people. And I think moving forward, it's something that we're going to adopt. We have used it in several other forms, maybe to give people information, but then again, it's more or less, let's say women come to the clinic and then we have a video playing, giving them health talks and health information. But now being able to give them that information just at the swipe of, you know, their mobile phone is something that we're going to take forward from this pandemic. So it's been a learning experience for a lot of developing countries, but it also shows that more and more people are going to need access to information, internet, and all of that.
Just to follow up on that, also, because I find it a very interesting argument. I mean, I'm just thinking, for example, in the UK, where I'm from, I mean, there was a noticeable shift from having these like family-based GPs that, you know, would accompany families for years and years, and they'd have all the knowledge of the families, and you would go to the clinic and you'd have these face-to-face interactions, and then that became more and more clinical progressively, if you like, and people were encouraged to phone the National Health Service and get kind of, you know, diagnoses over the phone, and then you never would see the same family doctor. There was a whole group of doctors that you would see, and so it became more and more what's the word in English, distanced, you know, and I'm just thinking how important the actual face-to-face meeting must be in terms of diagnosis. I mean, also in psychotherapeutic situations, you know, being able to see somebody's expression or being able to see the, you know, the skin, if the skin looks healthy, or, you know, see people close up because you're in contact with them. And in a sense, COVID has encouraged us to be ever more distant, have always less, you know, direct contact. I imagine from a medical perspective, that could be quite disastrous. Have you experienced any outcomes like this?
Absolutely. So, I mean, I've had people call me up and they're afraid to step out of their houses because of the pandemic, you know, and just having to interact with other people. And they call me up to give me some medical history about somebody. Some have even gone ahead to take photographs, and the photographs are not clear. And, you know, and someone sent me a video once of a child that was breathing with difficulty. And, you know, so I guess patients are finding ways around it, but it's still, I agree with you that I think we need to proceed with caution. There's nothing really replaces the face-to-face interaction. So we're taught in medicine that, you know, your your assessment of the patient begins from, some people don't like the term patient, of the client, as you were, but your assessment of an individual who's come to seek medical care from you begins when they walk into the room. You know, sometimes just the way their eyes or movements like wringing their hands, you know, their general demeanor can give you insight to what it is they're not saying. And in some cases, it's what the person is not saying that is the problem and not what it is they're saying. And so you have to read between the lines and also between the expressions. And that cannot be captured if someone is picking up a phone. Some people might, you know, display their emotions over the phone, but others might not. And so, you know, we need to make sure that we don't lose that touch. It's okay to share information, but I think when it comes to interaction, patient and doctor, I think, you know, we should still try and have that personal face-to-face touch wherever we can. The COVID-19 has made that a bit difficult and challenging, and it's hope that after this is all over, we'll be able to strike some form of balance in, you know, reclaiming the kind of lives we had before.
Thank you, Uduak. I'll just check if there's any final questions or contributions, or Domitiana. Yeah.
Hi, Uduak. This is Domitiana.
Hi, Domitiana.
It's really nice to hear you. I think my question is just maybe a follow-up on the one that you just answered, because I was wondering if you had any thoughts about the role of scientists as communicators, because I think that's something that has been, you know, on the press so much, and we've discussed at ESOF so much during the past days, how researchers and doctors have been really on the news, you know, since February, and how the public might respond to all this influx of information. And I was wondering if you have any thoughts on the role of scientists and how they can communicate better, maybe to the public, and how can play a role in shaping how we talk about this pandemic and maybe, you know, other future crises to come.
Thank you, Domitiana. It's really an important question you asked, because you know, we live in an era of genuine news, fake news, conspiracy theories, and so many things. And it's difficult, even as a healthcare worker sometimes, you know, to keep abreast of all the information that's out there and being able to verify that the information is correct. Then how much more someone that is not a healthcare, is not trained, you know, in any aspect or any medical related aspect. So even the terminology is scary. I belong to a WhatsApp group for my high school. So my high school year, we keep in touch, and sometimes people post things, and I can't believe that somebody actually believes it, but they genuinely believe it and they're scared. And you know, so I try sometimes to, given my experience and my background, to set, you know, them thinking the right way. But there are lots of people out there that are confused. What can scientists do? Scientists and medical personnel, we're not always trained to break down our information to lay people. So I remember when Erin was communicating with me about this, I asked her, okay, am I speaking to an academic audience or to a non-academic audience? And she said it's a non-academic audience. And it took me longer to write you know, the summary of what I was going to be talking about, because we're so used to all those words we use every day, which are, you know, a small thing to us, but, you know, to someone that's not medically trained, you know, it seems like a big deal. So I think one is being able to get scientists to learn how to communicate, but then also is the platform. You know, there's, I mean, with the way it is now, anybody can just post a video, record something and post it and share it. And it's difficult to get, you know, it verified that this is genuine or not. So yes, scientists have a role. Yes, we need to learn how to communicate our findings to non-academic audiences. But more importantly, we need a right platform that cannot be hijacked and that is credible and that people can trust.
Thank you, Uduak. It's really, really fantastic talking to you. Really interesting. I feel like we should have a regular radio slot so that you can tell us all of your very interesting thoughts and such great information for us. Thank you so much. Do you have any questions for us, Uduak, before we leave?
Could you tell me a bit more about the Euroscience Open Forum and what you've done this year, apart from this press tour?
Big question, big question. So I mean, I don't know if you know, but this ESOF edition was supposed to be taking place in July. It was supposed to be a huge in-person event. Because of COVID, it was postponed to this week. And right up until the last minute, I think nobody here in Italy was really clear, you know, if there would be a second wave, if it would actually be possible to have people present. And in the meantime, Trieste had the added major challenge of having to convert old dilapidated warehouse buildings along the old port into a brand new, shiny, convincing conference center. And so, of course, those building works were also delayed for many months. And so I don't know how everybody pulled it off, but right up until the last minute, now we're here and it's a fantastic, fantastic space. The physical space is really outstanding. They've got most things working perfectly. Everything is reduced in terms of audience though. So the big opening ceremony that should have had thousands of people here, we were all sitting on shiny plastic chairs 1 meter apart, so there were only 400 of us in the big opening ceremony, and attendance throughout the days is actually quite small, and it's very sad, really. All due precautions are being taken, but and so the idea of ESOF is really as a kind of, you know, a meeting point for scientists in Europe and a good networking forum, and, you know, the latest cutting edge results that are coming out of Europe. There isn't much emphasis or much exposure to scientists beyond Europe, as far as I can tell. And for that reason, it's been quite difficult for us to position ourselves in this conference. But what we have done is we have just tried to highlight when we can the work that people like yourself and our other fellows are doing, and just, you know, have an opportunity to say that they're these fantastic scientists, you should know about us. It would be great if you would connect with us. And now that we've just been told that we've got this Nature Award, I hope we will be getting lots of requests for more information as well.
I'm sure you will. Yeah, you will.
Yeah. I don't know if anybody else wants to say anything else to Uduak about ESOF, or no? No. Well, it's been fantastic talking to you, Uduak. Thank you so much for your time.
Thank you too. Thank you to everyone.
Yeah, we'll follow up with you later. Okay.
Okay. All right. Enjoy the rest of your day. Bye-bye. Bye.
Bye-bye. Ciao.
Bye.